want to talk to you about Invisalign today, the clear aligners that many patients come in and ask us about pretty much on a daily basis. So Invisalign treatment is just an alternative to using braces to straighten out your teeth and to correct your bite. Some patients may not be candidates for Invisalign, but usually we determine that on a case-by-case basis as the patients come in. But basically how Invisalign works is that you get a series of aligners that snap onto your teeth. They're clear and removable, so you can take them on and off to clean your teeth, and when you clean your teeth without them on, it's just as easy as if you're not in treatment. Depending on how much work needs to be done, you can have as few as 5 aligners or up until even 50 aligners. Each aligner is worn for 2 weeks, and basically each aligner progressively moves your teeth about 1/4 millimeter at a time. And so when we see patients and we explain how the treatment works, you leave typically the clinic having, let's say, 3 or 4 or even 5 aligners at a time. So you wear each aligner for 2 weeks, you progress to the next one, and we typically see patients anywhere from every 6 to 10 weeks. They're pretty easy to keep clean. We review all of that with you the day that we deliver the Invisalign aligners. They don't generally cause as much soreness as braces. They tend to be a little bit more comfortable from a tooth comfort point of view. Some patients complain a little bit more about feeling pressure with braces compared to Invisalign. You definitely have to be very compliant with wearing them and wearing them full time, or they do not work. It is not an appliance that is worn just to sleep. The other thing is that if you compare Invisalign to braces, braces are glued onto the teeth. So basically, when I have a patient in braces, the brace allows me to move that tooth in any direction that I need to. With Invisalign, because the teeth are all smooth surfaces, we have to add what's called attachments onto the teeth, and they are white composite bumps of different shapes and sizes that basically, when the aligners snap onto them, it's like having a handle on the tooth that allows us to move the tooth in the direction that we need to. And so that allows the more precision in the tooth movements that we want to execute. So if you have any questions about Invisalign, you can go ahead and post or come on in and see us at TG Orthodontics, and we'll be glad to answer.